Dr. Hoskins, is endometrial cancer worse for marginalized population? And are there any specific risk factors that put some at risk more than others?
So I think marginalized populations, I think we could say minority populations, we can say Black women, we can say Hispanic women, we can say people who, I'm trying to define, if you will, the marginalized patients who don't have access to care. Yes, I definitely think that you could, or they can have a worse outcome, whether it's for lack of, access for someone who may not be insured, or for patients who may be in this country without proper documentation, getting the medical care that they may need. I think it can certainly be, and I've seen those. I think risk factors, we've talked about race as being a risk factor. And again, access to care is certainly a risk factor. I think those are probably the bigger risk, if you will. So my activation tip for patients would be asking the question about their risk. If someone is not insured, asking the hospital or cancer center that's there about any resources that are available to say patients who are uninsured or underinsured, there are programs that are there. And even for medications, some of the manufacturers have programs that pay for medication. So I think in asking the ask question, I have no problem asking a question, right? So I think asking for yourself is not going to hurt. So disadvantaged populations could be patients who live in rural areas, patients with gender identity changes. So I think in terms of that, I think our Society of Gynecologic Oncology recognize it. I think number one, we have to recognize who the people are and who these populations are. And then at least for my most recent annual meeting have noted more talks that are about it. So it's just more education that we are seeing. And again, even more, some more data, particularly with patients that live in rural communities where they have lack of access to, say, gynecologic oncologists, where they have to travel. And so I think one, recognizing it, and in terms of what's being done, I think there's more to come. My activation tip for patients would be, if you are in a disadvantaged population, perhaps inquiring with, say, local groups that you are aligned to, or even, let's say, someone who may live in a rural community to figure out where they can get the best care that's local to home. So, and I mean, these are things that we recognize that may be coming about soon.